in the lymphatic system. Right here you have the different organs in the lymphatic system. Lymphatic vessels in green, bone marrow, spleen, lymph nodes right here, quite a few as you can see, as well as the thymus. Those are the main organs in the lymphatic system. So let's keep scrolling down. Let's talk about now the functions of the lymphatic system. There are three main functions: fluid recovery, immunity, and lipid absorption. Fluid recovery, as you know, when we are talking about the capillaries, for example, we were saying that most of the fluid as well as the nutrients are going to be absorbed at the level of the capillaries. I said most of them because approximately 80 to 80% is reabsorbed by the capillaries. However, the 15% to 20% that remains in the tissues is reabsorbed by the lymphatic system. What happens when you don't reabsorb the fluid properly for whatever reason, disease and particular medical condition, then obviously this is what's going to happen. Probably it's caused by an infection, but you can see in there that if you don't reabsorb the fluid, then you're going to start accumulating this fluid in your body. That's called edema. Immunity, because your lymphatic system is going to recover the fluid, and in this fluid many times you're going to find bacteria, viruses, in other words microorganisms that may cause infection, and the lymphatic system obviously is going to be an important part of immunity because it's going to help you fight these microorganisms that may cause disease on you. Lipid absorption, as you know, we are going to absorb nutrients at the level of our intestines. You absorb proteins, you absorb carbohydrates, and there's no problem with them. But as you know, there's a famous saying that says water and oil don't mix. So fat is oil basically, and your blood has a lot of water. So then it's not really easy then when you absorb the fat to be placed directly into your blood because your blood has a lot of water, and we are saying water and oil don't mix. So therefore, since they don't mix, that would cause a problem, for example, because the fat may be stuck in the little capillaries that you have in your fingers, therefore causing problems. So for that reason, you don't absorb the fat directly into your bloodstream, rather it is absorbed through the lymphatic system. The lymphatic vessels that you're going to use in your intestines to reabsorb the fat are going to be called lacteals. So let's take a look at lymph. Lymph is basically the fluid that goes through your lymphatic vessels. The same way the blood goes through the blood vessels, well, in this case, lymph goes through the lymphatic vessels. Lymph is going to have more or less the same characteristic that plasma has, but it has less proteins. The lymphatic vessels, the smallest lymphatic vessels are going to be obviously lymphatic capillaries, and you are going to find lymphatic capillaries in your whole entire body, except in some areas that are very specific, such as, for example, your nervous system, cornea, bone, as well as cartilage. So one characteristic that lymphatic vessels have is that they resemble the veins. One characteristic that the veins and the lymphatic vessels are going to have is that veins have valves and lymphatic vessels have valves as well. So right here you see the blood vessel capillaries right here, and you can see in here the capillaries in this case that belong to the lymphatic vessels. Okay, very important, because the excess fluid that is going to remain in here that is not going to be reabsorbed by these capillaries is going to be reabsorbed by the lymphatic capillaries. Okay, so if we keep scrolling down, right here you can see the lymphatic vessels again allowing this fluid to be reabsorbed. Let's keep going, and we see right here that you have valves in the lymphatic vessels. The valves in the lymphatic vessels are going to help return lymph back towards the heart. One thing that you need to remember is that the lymphatic vessels don't have the help that the heart provides to the blood flow. So right here in this figure, you can clearly see the valves. The lymphatic vessels also follow more or less the same number of layers that blood vessels have, in particular the veins again. We said that they have 3 layers, so then the lymphatic vessels also are going to have 3 layers: tunica media, tunica interna, and tunica externa. So you scroll down. So then we reabsorb the fluid, the excess fluid, using the lymphatic capillaries. The lymphatic capillaries are going to follow a sequence of vessels similar to the blood vessels that we have, large, medium, and small. Same thing in here, the lymphatic capillaries then connect to collecting vessels, lymphatic trunks, and from there the collecting ducts. And then they're going to drain this fluid that is absorbed from your tissues into the subclavian vein. Then the subclavian vein is the area where all this lymph is going to get mixed with the blood, and then is going to return into your heart. As you can see here, The lymphatic vessels collect the fluid, and you can see the arrows, how it's showing you that the arrows goes up. Here's the lymphatic vessels from the upper part of your body, and you can see here how they dump the lymph into the subclavian vein, and from the subclavian vein into the superior vena cava, and the superior vena cava is going to return the blood into your heart. Then your heart is going to pump all that fluid already mixed with your blood that it has no difference now, it's just blood, into your body. Lymph nodes. These ones are lymph nodes. They are located all over the pathway of the lymphatic vessels. So if we scroll down, the collecting ducts. There are two main ones. One that is going to dump the fluid into the right subclavian vein, and the one on the left that is going to dump the fluid into the left subclavian vein. If we keep scrolling down, you can see that right here you have the one for the right lymphatic duct. Then technically this one should be the left lymphatic duct right here. This one, left lymphatic duct, because it's going to end in here. However, this is not left lymphatic duct. This is going to be called the thoracic duct. And you're going to be able to see right here that this one for the right side reabsorbs only the fluid from this area right here, basically from the middle upper right side. And the thoracic duct, the one for the left side, reabsorbs basically the rest of your body. So basically, instead of being divided in two, as you can see in this figure, here in purple is showing you what the right lymphatic duct is going to reabsorb of what areas. And in here you can see all the other areas that are going to be reabsorbed by the thoracic duct. So the fluid reabsorption is not divided 50-50 in your body, but rather, 3/4 to 1/4.